Good evening. It's Sunday, August 2nd, 3:24 p.m. I want to talk about Yemen briefly because nobody seems to be really talking about the cover up going on in Yemen and how there's a lot happening there and the virus is just all over the place. But the officials there are not telling us their true story. So Seizure report number 62, SARS-2 rampage in Yemen. Government officials suppress information and try to cover up early SARS-2 deaths as swine flu. 97 medical workers in Yemen have died of SARS-2, including infectious disease experts, medical directors, midwives, and pharmacists. Yemen's true extent of the outbreak likely has been much worse. Limited testing capabilities and access to medical facilities made it difficult to get the numbers. Yemen will be slammed by the virus as it takes root because of the weakened immune systems, malnourishment, and a prolonged state of poor health. Now that's happening in India. In India, there is a very, very alarming amount of children that smoke, which just overall adds to increasing their risk of succumbing to the virus. Hundreds of kids have died in India. That's something else that is not talked about much in the mass media, as expected. Thousands of Yemenis flee SARS-2 hotspots. Displaced women who used to work as maids are forced to beg in the streets because potential employers are afraid they are carrying SARS-2. In Aden hospitals, they are turning away suspected cases because of overcrowding and lack of equipment. The agency expresses concern that many Yemenis are not seeking medical care until their condition is too serious to treat because they believe hospitals are the source of infections. Wow, it's a hot day today, by the way. Hot day in LA. Oxfam reported that this year more Yemeni citizens may die of starvation due to the outbreak of SARS-2 and rise in food prices. Now, this is something that we need to really watch out for in a lot of other countries. Yemen is there's going to be a lot of countries like Yemen, or that already are at this point. Yemen cemetery struggles to dig enough graves as SARS-2 spreads. They had to hire mechanical diggers and use graves intended for others to keep up with the dead. The Houthi movement, which controls the most large urban centers, has not provided figures since May 16th. A government health spokesman said it reported figures daily and nothing was hidden, but it didn't respond to calls. That's an absolute lie. Now in Yemen, many are unable to afford health care or go broke trying to. They are being refused service from hospitals. Many families end up watching their loved ones die at home. There was a case where the family had to carry a man from the hospital back home because the hospital refused to help him or to help transport him. And I do have an early report on Yemen from months ago where it adds that piles of dead bodies are being labeled as unidentified bodies from the war to cover up the epidemic. They did that, and then they also blamed swine flu because they didn't want people to know the government in Yemen didn't want the public to know, or the world to know, what was going on in Yemen. The social media on SARS-2 was being suppressed, and rebels found the war as certain elements within Yemen found the war as a convenience to hide the real numbers. So already months ago, we already had reports saying that SARS-2 had already killed many people. It says the real numbers are much more than official figures. And so this is old info. This is old info compared to what I just told you a few minutes ago. Now here's more of the cover-up. Health Minister of Yemen says he won't publish the numbers because it will have a heavy and terrifying toll on people's psychological health. That's just a foolish statement to make, and does not reflect being transparent and being fair and being honest. The test results aren't released, and families have no confirmation if their relatives died from SARS-2. Yet there are people who in Yemen who have their family members die in the hospital and they don't even get tested. And oftentimes they got to pay for the test, and they got to sell their precious belongings to have money to make a test, to pay for the test. Because now we see people dying in the streets, healthcare providers are passing away, then the country is running out of its healthcare providers. At the time that it made this report, it says 46 medical workers have been killed by SARS-2. And now, months later, that I gave an update report, now we are at, 96? 97, we're 97 medical workers. And that's just based off of the activist groups. That's their tally. It's probably even higher than that. But I want to give an update on Yemen. We need to spread more info on on what's happening in this country. The people here are being ravaged. And so I wanted to make more people aware. And that will be it for this update. And thank you for listening. And I'll see you later today for the update.